In this video, one therapist will be transferring Andrew using a sliding board as if he is dependent and has quadriplegia. Step 1. Wear your OT shirt, fieldwork pants, and name tag. Have your hair tied back, no dangling jewelry, and wear athletic shoes with good tread. Step 2. Introduce yourself, explain the transfer in simple everyday words, and remove the footrest or swing away as needed. Have the patient help as able and place the wheelchair at a 45-degree angle.
Hi Andrew, I'm Cindy from OT, and we're ready to get you on the mat to work on some exercises today. The first thing we're going to do is take these footrests off, and I'll be doing all the work today. You want to make sure that you bend your knees and that you're not leaning over the patient. That's better body mechanics. And you also want to get the wheelchair at a 45-degree angle. That seems to be the best angle before you lock the brakes. Make sure both the brakes are locked.
Step 3. Lock the brakes, lean the patient's torso forward, and support with your shoulder or body. Secure the safety belt around the patient at the pelvic or hip level. Then lean the patient's torso back into the wheelchair.
Andrew, I'm going to lean you forward and put this safety belt around you so that I can help control your body as you're moving over to the mat.
Step 4. The large part of the front casters needs to be forward. Scoot the patient's hip forward, 1/2 the seat of the wheelchair, by the therapist sitting down on the mat, bracing the wheelchair with their foot, then pulling the patient forward from behind their knees.
I'm going to sit on the mat, and I'm going to put a foot on the wheelchair. Actually, I'm going to put a foot on the other side, I think, to stabilize it. And I'm going to pull the relax your legs. I'm going to pull the patient out about halfway on the seat. And again, I want to make sure the casters are forward so that the weight of the patient doesn't have them falling forward.
Step 5. Remove the armrest from the mat side, then remove the armrest from the other side. Place the armrest out of the way. Place the patient's head under your arm furthest away from the mat. Place the sliding board completely under the patient's thigh closest to the mat with the beveled side of the sliding board facing up.
So you want to remove this armrest and place it out of the way so the patient will not be laying on it. You also want to remove the other armrest. And place it out of the way. Okay, I'm fairly short. I'm 5'1½", and Andrew's 5'11" or so. So if you're shorter and your patient's taller, you actually want to bring your knees past their knees. It's almost like you're closer to their body. All right, and I'm going to take Andrew's head and tuck it under the arm furthest away from the mat. I'm going to take the sliding board and with the beveled edge, put it under his thigh as I lean him over. I got you, I'm not going to drop you. And you need to get it at least halfway. Let me make sure it's under far enough. Okay, try not to pinch their skin. And I'm going to see if I can get Andrew just a little bit further down. The more their body is bent, the better control you have of the transfer.
Step 6. Use the proper therapist's body mechanics. Keep your back straight, bend your knees, one foot in the direction of the move. The foot furthest away from the mat needs to be inside the front wheelchair caster.
I hope the wheelchair holds. All right, what we're going to do is rock back and forth, and on the count of 3, I'm going to slide you part of the way over. Okay? 1, 2, 3. so we have the patient over on the mat.
Step 7, the therapist's hands need to be on both sides of the safety belt. Get the patient's verbal or nonverbal okay for the transfer and that they are ready. Count 1, 2, 3 using a sideways momentum on each count. On the count of 3, slide. Do not lift the patient on the sliding board. Repeat 2 or 3 times as needed to complete the transfer of the patient to the mat.
All right, what we're going to do is rock back and forth, and on the count of 3, I'm going to slide you part of the way over. Okay? 1, 2, 3. That one feeling smooth.
Step 8. The therapist needs to keep their back straight and knees bent to lower the patient to the mat in the supine position. Do not allow the patient's skin to contact or lie on any hard surfaces. Also, you need to replace the wheelchair parts.
And I'm going to move the wheelchair out of the way so I can get the board out from under him. Okay, you want to have full control of your patient. And on this transfer, he has no movement below his neck, and so he's not going to be able to sit here on the mat safely. So I'm going to lower him gently to the mat. I'm going to lower his head and trunk first. All right, and then I'm going to bend my legs and get the rest of his body safely up on the mat. Okay, and then you can put the wheelchair back together. Then you wouldn't do this in the clinic, but as an instructor, I want to know that you know how to put the wheelchair back together. So, as part of the competency, you want to make sure that you remember to put the footrest back in position and the armrest back in position on both sides.
Step 9. The therapist needs to display planned, efficient use of his or her time and energy. Also, display problem-solving skills if the transfer did not go smoothly and safely. Step 10. The therapist needs to display confidence, calmness, and firmness in all patient interactions during the transfer.